afternoon, one and all present here. I, D. Minaha from 3rd BSc Biochemistry, welcome you all for today's webinar on menstruation health and hygiene management, conducted by IQAC and Women's Cell of Untitled Arts and Science College. பட்டங்கள் ஆள்வதும் சட்டங்கள் செய்வதும் பாரினை பெண்கள் நடத்த வந்தோம் 8 மறுப்பெண் ஆண்களின் பெண் இனிய பிள்ளை என்று கூற வந்தோம். Menstrual hygiene. Menstrual hygiene is vital to empowerment and well-being of women and girls worldwide. It is about more than just access to sanitary pads, appropriate toilets, and are more important. It's also about ensuring women and girls live in an environment that value and support their ability to manage their menstruation with dignity. In this webinar, you will be answered with all the questions that is related to menstrual cycle and hygiene management. One song can change the moment. One idea can change the world. One step can start the journey. But a prayer can change the impossibility. Now, I request our college choir for prayer song.
My strength when I am weak, you are the treasure that I seek. You are my all in all. Seeking you as a precious jewel, Lord, to give up I'd be a fool. You are my all in all. Jesus, Lamb of God, worthy is your name. Jesus, Lamb of God, worthy is your name. Taking my sin, my cross, my shame, rising again, I bless your name. You are my all in all. When I fall down, you pick me up. When I am dry, you fill my cup. You are my all in all. Jesus, Lamb of God, worthy is your name. Jesus, Lamb of God, worthy is your name. Worthy is your name. Worthy is your name.
Thank you, college choir. A small cheer and a great welcome make a merry feast. Now, I invite Mrs. K. Meena Ma'am, Assistant Professor, Department of Biochemistry and Women's Cell Coordinator for welcome address and introduction of guest speaker.
Good afternoon, everybody. The empowered woman is powerful beyond measure and beautiful beyond description, said by Steve Maraboli. The women's cell is dedicated to the goal of promoting overall health, mental and physical social well-being of women and girls throughout the campus. Women's cell nurtures women for better health by educating them and providing a network of assistance, workshops and counseling to strengthen their female values such as creativity, empathy, emotional skills, mutual connection and economic status. On behalf of IQAZ and Women's Cell of our college, I'm extremely very happy to welcome our chairman, Dr. N.R. Dhanapalan sir, secretary, Mr. N.R.D. Premkumar sir, joint secretary, Dr. P.E.R. Premchand sir, principal, Dr. Inita Ebensi ma'am, vice principal and IQAC coordinator, Mrs. Jafia Solomon, HODs, faculty members, and my dear students of Annai Violet Arts and Science College, and also other participants for today's webinar session on the topic of menstruation health and hygiene management. I would like to introduce and welcome our guest of speaker for today's session, Ms. Roshni Baumik, CSR Executive Unicharm India. She is working with Unicharm since 2018 and mainly responsible for all CSR activities in Kolkata. She also campaigns for menstrual health and hygiene management in educational institution, in non-profit organization, and in the community level as well. She has conducted sessions on menstrual health in more than 90 plus institutions across Pan India. She also graduated with psychology honors and completed masters in social work. She has worked in the area of child protection and health for more than 6 years. Welcome you, ma'am. With this note, I would like to present the Women's Cell activities from 2000 to 2021. Here it goes. So Women's Cell activities report from 2019 to 21. In 2019-20, the awareness program on self-hygiene conducted on 7th August 2019. Seminar on women's self-confidence on 14th August 2019. Awareness program on implementation of Kavalan app on 11th December 2019. International Women's Day celebration, Generation Equality, Realizing Women's Right on 9th March 2019. In 2020-21, live webinar on gender equality and women's rights on 20th July 2020. Webinar on cancer awareness program on 8th September 2020. Inauguration of Women's Cell with a live webinar on the topic Singapore on 15th October 2020. The World Cancer Awareness Day awareness program was conducted on breast cancer on 4th February 2021. Awareness program was conducted on self-defense on 17th February 2021. International Women's Day competition Choose to Challenge on 6th March 2021 as per the University of Madras. The topic Choose to Challenge. International Women's Day 2021 Cancer Awareness Program was conducted on 8th March 2021. Thank you. So these are the events activities conducted in 2019 to 21. Thank you, ma'am. I welcome you. Roshni, ma'am, I welcome you.
Now with our guest speaker, Mrs. Roshni Balwan, CSR Executive, Unicharm, India, to address the gathering and to give her valuable input to the gathering who are inspiring her. You are very motivated people by giving us a living example by sharing your experience and knowledge.
So good afternoon, everyone. So before I begin my session, good afternoon and welcome to the session. Let me first share my screen and thank you for the very warm introduction given for me. I hope my screen is visible to all.
Yes, ma'am.
Okay. So to give an introduction about Unicharm, of course, an introduction about me has been given that I am from Unicharm. But what exactly is Unicharm? The name Unicharm might not be that familiar, but people are aware of its brand products. The main brand products of Unicharm are Mami Coco Pan diapers and Sophie sanitary napkin. So it is a Japanese company which has started out in India in 2008 and since then has been manufacturing these products in India. And it also manufactures adult pant style diapers under the brand name of Life Free. So we basically and as introduced by ma'am that I am from Unicharm CSR department, that is the Corporate Social Responsibility Department, wherein we organize sessions on menstrual health and hygiene management across various educational institutions. So to begin with, a disclaimer from our side is that the entire process of periods or menstruation ultimately depends upon the person. So today, whatever information I am going to share is based on general knowledge, general experience, and general data that is available to us. But ultimately, the entire process will depend upon the person's body type. Most girls do get their information on periods, the first information on periods, especially from their mothers or from their family members. But having said that, or receiving that information from their mothers is good, but please do not compare yourselves with your friends or with your family members, especially your female family members, your mothers, your sisters, or aunts, because their experience might not be similar to you. So I will be talking about the abnormalities, the problems related to periods, but please do not get confused thinking that those similar symptoms are experienced by you, therefore you might have some problem. Maybe according to your body type, that is normal for you. So why are we discussing about menstruation? What is the reason that we are arranging this webinar today? So first of all, period is still considered a taboo and a myth in most of the Indian societies. We don't talk about it openly. Especially, we are told that it is a subject which should not be spoken in front of the boys. Apart from that, many of us think that period is something which makes a girl or a woman impure. When on the periods, one can't enter certain places, one can't cook, one can't enter kitchen, one can't sit on the bed. But please remember, the entire process of menstruation is a very natural biological process. So just as we breathe, we get hungry, we feel thirsty. Having period means that our body is functioning normally. So any woman on earth, if her body functions normally, she will have a period. It is nothing that is a choice we have that we avoid. So it is bound to happen. So there is nothing to be ashamed or guilty about it. Also, we take these sessions with adolescent girls. So it is specially for them that we tell them that it is a subject which should be known by a girl before they start with their periods. Because when a girl suddenly starts with her period, not knowing about the entire process, she gets panicked, she gets shocked, she doesn't know whom to approach, what to do, or how to manage it. So we start by telling them from before about the entire process, how can she manage it, so that she becomes prepared. Of course, when it will start, it will make that person uncomfortable, it will make the girl uncomfortable. But again, there is some sort of preparedness in her. Also, along with periods comes very many other physical changes. It is also important that they know about those physical changes, again, so that they may stay prepared. And especially in today's time, along with periods do come very many different menstrual abnormalities. There are very many problems related to periods. So it is important that you know the process behind it, the reasons behind it, the basic reasons behind it, so that in case of any problem, one may take appropriate healthcare measures. And it is important that you maintain your hygiene properly, because at times, due to poor hygiene management, there are very many menstrual abnormalities which can't be controlled later. So it is important that you maintain your hygiene properly. So we start with a bit early, that is, and I spoke about that we have physical changes, and when should a girl start with their periods? So we all grow up. From childhood, we grow on to become adults. So when we grow up, when we start growing towards the adulthood stage, we enter the adolescent stage. So the adolescent stage are mainly the teenage years. So the adolescent stage starts from 10 years onwards, it goes till 19 years. When a child enters the adolescent stage, be it a girl or a boy, they start with the process of puberty. Now, what is puberty? So puberty is the process of physical change wherein the child's body matures into an adult one. and then one is capable of reproduction. So, excuse me. So when the process of puberty starts, there are very many hormonal changes within the body, which leads to different growth and development in different parts of the body. So in very simpler terms, it is a time frame when a boy turns into a man and a girl turns into a woman. So when for us girls, the puberty process starts a bit early. That is around the age of 8, 9, or 10 years onwards. For boys, it is a bit late. That is around the age of 11 or 12 years onwards. So it continues throughout the middle adolescence phase and ends around the age of 19 years or a little beyond that. So what sort of physical changes am I talking about? So there are few common changes that both boys and girls go through. Those common changes being the height increases, the weight increases, there is growth of hair in the underarms and in the pubic area, there might be acne or pimple problem. Apart from these problems, there are few problems which are only specific to boys. Those changes being their voice deepens, their shoulder broadens, there is growth of facial hair, and also their reproductive organs or sexual organs develop. So the main hormone testosterone is responsible for the changes, for these changes in the boys. For girls, the specific changes being the breast size increases, the pelvic area or the hip area widens, and girls do start with their periods. And the female hormones, estrogen and progesterone, is responsible for the changes within the girls. So just as we go through a lot of physical changes, there are lots of behavioral changes as well. So when we take sessions with parents, so most parents are very much concerned that the height is not increasing, or my girl has not started with their periods. Yes, it is important to be concerned about the physical development, but they most often ignore the behavioral changes as well. So most of the times parents do complain that I'm not able to understand my child. She is getting out of control or he's getting out of control. I can't handle my child. So it is important that they know about those behavioral changes as well, because those changes are also caused by the hormonal changes. And it is important to support them during those behavioral changes, especially those behavioral changes, because it is something they can't control at times. So what are the behavioral changes am I talking about? So the very first emotional change that when you notice or when you see a boy starting to behave differently is when they start showing sensitivity towards all right. So they become very sensitive and emotional. So what is being sensitive or emotional? So especially at times when even a person rebukes an adolescent or tells them something or comments on them, they become very angry or they become very sad. They cry for very small reason. So especially in the early adolescent stage, when they start with their physical development, so most often they do not know what are the changes they are about to experience. So those changes actually inspires a lot of curiosity among them. In terms of thinking also, they have a very black and white concrete thinking. If they like something, they like it a lot. If they don't like something, they hate it. So there is not much room in between. So there is a gradual increased need for privacy then, and this gradual increased need for privacy heightens in the middle adolescent stage. So it is in the middle adolescent stage when the mood swings is at its peak, they go into a lot of arguments with their parents, they get easily distracted, their attention span is less, there is a lot of pressure around them, be it from their peers or be it from their family members also. So at times, in order to prove themselves, in order to make themselves belong to a particular group, they tend to take part in activities which shouldn't be done. Or also when they see others, when they see their peers, they are doing well in their academics or extracurricular activities, it might also inspire them to do the same. So it has its both pros and cons. Also, they are very much concerned about their appearance. At times, there is a lot of insecurities about their looks, about how they would dress up. So they do spend a lot of time in front of the mirror as well. So now when they enter the late adolescent stage, so it is the stage when they do come to terms with their own values. So they are able to gauge the risks and rewards better. And also in terms of relationship, be it with their family members or be it with their parents, or be it with their friends, their relationships have much more stabilized. So these are the different changes in their behavior that the adolescents go through during all those three stages. Now we come on to the reproductive phase in a woman. So the very first time a girl experiences periods or a girl starts with a period, it is known as menarche. So it is the very first time a girl experiences bleeding from her vaginal opening, it is known as menarche. So before menarche, will a girl be able to know that she is about to start with a period? Will there be any signal from her body? Yes, there will be. So most of us, since we don't know about it, we tend to ignore it. So many of us think that since we start with the aches or cramps in our stomach, it is a signal from our body. But many girls do not experience any cramps or aches. But one thing which is common for all is white discharge. It can happen in very small amount also. Now, what is white discharge? It is a pale yellow, sticky, slimy, mucousy-like secretion which comes out of our vaginal opening. It could be whitish in color, it could be pale yellow, it could be colorless, it could have an odor, it could be odorless too. So when a girl starts with a white discharge, then she would know within the next 3 to 12 months, anytime within the next 3 to 12 months, she might start with a period. She might start with her menarche. So it is a signal. So we suggest the adolescents, for those who have not started with their periods, when she starts with her white discharge, then she starts keeping a sanitary napkin with her, because anytime her period might start. So at what age should a girl start with her menarche? So there is no particular age that from this age onwards only she should start with her menarche. But there is an age range, and that range is from 8 to 15 years. Anytime within the age 8 to 15 years, a girl can start with her menarche. So there is no good age or bad age. There's no better or worse. So anytime in between 8 to 15, a girl can start her period. So on what factors does this age of menarche depend upon? So it depends upon the girl's regular diet, the environment she's living in, her physical health as well as her mental health. Depending upon all these factors, and as well as the genetic factors also, it also depends upon when her female family members started with her period. So depending upon not only one, but on all these factors, will the age of menarche be determined. So now what is menstruation, or what happens during periods? So when I do ask this question to girls or to the parents, the most common answer I do get is that it is a cleansing process. The dirty blood or the impure blood gets discharged out of the body. But it is not so. So it is an entirely wrong thinking, wrong idea that many women harbors, that it is the impure blood which is being discharged out. So periods or menstruation is basically the periodic discharge of blood and mucosal tissue from the vaginal opening. And the blood and mucosal tissue which is being discharged out is not impure, dirty, or toxic in nature. Now, many women also do have the idea that we bleed from the same area from where we urinate. So we tell them that the female genital area has 3 separate openings. So first is urethra, from where we urinate. Second is vagina, from where the blood during our period is discharged out. And third is anus, from where we defecate or excrete. So please remember, the opening from where we urinate is separate from the opening from where the blood during our period is discharged out. So the number of days a woman should usually bleed is for 3 to 7 days, minimum of 3 days, maximum of 7 days. And the menstrual cycle may last for 22 to 40 days. Now, these two can differ from woman to woman, but for a particular woman, it should be fixed. So it is more or less fixed. So if a particular girl bleeds for 5 days and her menstrual cycle is of 30 days, so she will start her periods after every 30 days and she will bleed for 5 days, and it will continue to happen unless and until there is some major change within the body. So from where does the period or the menstrual blood is prepared, or from where is it discharged out? So that is can be seen by studying the female reproductive system. So this is the female reproductive system. It is situated in the lower abdomen of our body. So what are the different parts of the reproductive system? In the middle, there is a muscular organ which is known as the uterus. The inner lining of the uterus is known as the uterine lining. So when a woman is pregnant, when she is carrying the baby inside, it is inside this uterus that she is carrying the baby. So it is kind of elastic in nature. It can expand in size. So when a woman is pregnant, it can expand up to 500 times. Now on both the sides of the uterus, we have the ovaries. The ovaries contain eggs. Okay, the ovaries contain 10 to 20 million eggs. So by the number of it, you can imagine the size of those eggs. The function of the ovary, so when we girls are born, we already have these eggs within our ovaries. It is not that it is formed when we grow up, or it is made when we grow up or when we are of age. So when a small baby girl is born, she already has these eggs inside her ovaries. Now, attached to the ovaries, we again have the fallopian tube. So the function of the fallopian tube is to carry one single matured egg from the ovary towards the uterus every alternate month. And below the uterus, we have the vaginal tract, which leads to an external vaginal opening in our genital area. So what happens inside this reproductive system which leads to a period? So that can be studied by studying our menstrual cycle. So, and also it would also explain that why the blood during our period is not impure or dirty in nature. So the menstrual cycle begins on the day 1 of our period. So suppose a girl bleeds for 5 or 6 days. So after her period stops on the 5th day or on the 6th day, then immediately the inner lining of the uterus starts to prepare itself for the possibility of bearing a baby. So how it prepares? So the inner lining starts to thicken. It becomes enriched in blood and nutrients. Layers of blood is being deposited onto the inner lining of the uterus. Why? Because if a baby is to grow within the uterus, then that same lining would provide protection and nutrition to the baby inside the womb. So while the inner lining is thickening simultaneously around the 14th or 15th day, an egg from the ovary gets released and through the fallopian tube starts to travel towards the uterus. While traveling, if the egg gets fertilized, then the fertilized egg will implant itself onto the same uterine wall or to the endometrium layer. So thereby it will convert itself into a fetus, thereby to a baby. So when the fertilization process does not take place, so depending upon the girl's menstrual cycle, be it on the 20th day or on the 30th day, or whatever day it is, or on the 32nd day, when the body notices that the egg is not yet fertilized, then the hormones signal the uterus to shed the inner lining along with the unfertilized egg out of the body. So the blood which is being discharged out is the inner uterine lining or the endometrium layer along with the unfertilized egg which has been disintegrated. So it is not impure, toxic or dirty in nature. Why so? Because the same uterine lining provides protection and nutrition to the baby. Had it been impure, dirty or toxic, it wouldn't have been able to provide that function. Also, it is coming out of our own body. Had it been impure, dirty or toxic in nature, we ourselves wouldn't have been alive. So it is just the lining not required by our body at that point of time, which is being discharged out. Many of us think that there is a lot of blood loss during our period days. But again, it is not so. Only 2 to 3 tablespoons of blood is being discharged out during our period days. The rest is all other kind of secretions like endometrial fluids, vaginal microbes, and mucosal tissues and white discharge. And those are also not impure or toxic in nature. So just as we start with a period, the process which was known as menarche, there also comes a time when our period stops permanently, and that process is known as menopause. Anytime within the age 45 to 55 years, a woman can experience menopause. When a woman approaches menopause, she suffers from irregular periods. She might suffer from mood swings. She suffers from memory loss. She could gain weight. She would not be able to sleep at night. She would have night disturbances. She would have hot flashes. And there are very many effects on her body. So we suggest if a woman is not able to cope up with the effects of menopause, then doctor's consultation is required. It is important that they do go and consult with the doctor. At times before the age of 45, many women might experience menopause, and that could be caused by reduction in the hormonal levels, enzyme deficiency, maybe due to thyroid disorder, maybe the ovaries has been surgically removed or due to chemotherapy treatment. And at times, even after the age of 55, many women continues to menstruate. So that is known as late onset of menopause, and it could be also caused by thyroid disorder, obesity, high level of estrogen secretion, and maybe due to genetic reason. So if you notice any women, even if they are suffering from a premature menopause or late onset of menopause, they also need to consult with the doctor. So next we come on to menstrual management. So it is important that one track their periods. It is very, very important that they do so. So one's period should be regularly tracked. What is the benefit of doing that? So one gets to know the number of days she is bleeding, and the length of the menstrual cycle. Again, what is the benefit of doing that? So that she can stay prepared for her next period. And how does one calculate the menstrual cycle? So if one regularly marks a period, so the menstrual cycle is calculated from first day of your menstruation in one particular month to the first day of your menstruation in the immediately next month. So if one counts the number of days in between, it usually comes in between 22 to 40 days. So on an average, most girls have a menstrual cycle of 28 days, but it is not necessary that it should be of 28 days. It can happen anytime in between 22 to 40 days. So nowadays, there are very many menstrual abnormalities. So if one tracks a period regularly, if one notices any abnormalities or any irregularities in the menstrual cycle, one may immediately take appropriate healthcare measures. So next we come on to premenstrual syndrome. So at times before our periods or during our periods, many women experiences mood swings. They feel irritated, upset. They don't like to socialize. So these symptoms are known as premenstrual syndrome, and it is caused due to the hormonal changes. So the hormonal changes leads to an emotional turmoil, and hence girls do react in certain ways. So it can happen, it can also not happen. Both are equally normal. So when should one consult with the doctor? So if a girl starts a period before the age of 8 years, or if one has not started her periods even by the age of 15 or 16, then doctor's consultation is required. Also, if one's menstrual cycle is very irregular in nature, suppose one is bleeding for less than 3 days, more than 7 days, continuously bleeding for months, or not getting her periods for months, then doctor's consultation is required. Also, the flow during period is if one's flow is so heavy that one needs to change the pads every 15 to 20 minutes, or if the flow is so low that even after 4 or 5 hours on the second or third day, there is only 1 or 2 drop of blood, then it is not normal. Doctor's consultation is required. Also, if one has very heavy white discharge, having white discharge is also normal, provided one has it for 2 to 3 days before and after their periods. But if one is continuously having white discharge and the innerwears are constantly wet and it is yellowish, brownish, or greenish in color, and it has a fishy smell to it, then doctor's consultation is required. And lastly, I spoke about this earlier. If one is not able to cope up with the effects of menopause, then doctor's consultation is definitely required. So there are very many menstrual abnormalities which are very common nowadays. So the most common menstrual abnormalities include dysmenorrhea. So dysmenorrhea is extreme pain during periods. Now, many women or girls experiences cramps or pain during periods. Now, the cramps or pain which are bearable is kind of normal in nature also, because the uterus actually contracts and expands in order to discharge the inner lining out of the body. So it squeezes the inner lining. So when it contracts, it presses against the nearby blood vessels, cutting off the oxygen supply to the muscle tissues. Hence, we experience that pain. But if a certain pain is very, very intense in nature, that one can't get out of the bed, can't do their basic chores, and it is accompanied by nausea, loose stools, dizziness, and headache, then there might be some other obstruction within the reproductive system which is causing that pain. Second is amenorrhea. Amenorrhea is the absence of period for more than 90 days. So unless the woman is pregnant, breastfeeding, or going through menopause. So if a young woman who has not started her periods by the age of 15 or 16, or even after 3 years when her breast begins to develop, then it is considered as amenorrhea. And lastly, there is abnormal uterine bleeding, which includes extremely heavy bleeding or spotting in between periods, after periods, or even after menopause. So, what causes these menstrual abnormalities? So, first is stress and lifestyle factor. If one is leading a very stressful life, if one's lifestyle is very erratic in nature, if one is into extreme routine or extreme dieting, it can affect their menstrual cycle. If one is on and off on birth control pills, then it affects their menstrual cycle. Again, if one has developed polyps or fibroids. So, what are polyps or fibroids? These are small growths within the inner lining of the uterus. These are small tumors which are usually benign in nature, that is non-cancerous in nature, but the range of these tumors can range from as small as an apple seed to as large as a grapefruit. And it may cause extremely heavy bleeding and pain during periods. Second is endometriosis, wherein the inner lining of the uterus is formed on the outer wall, or the endometrium layer is formed on the outer wall of the uterus. Thereby, it leads to extremely heavy bleeding, abnormal bleeding, cramping, pain during and after periods, and it is and the menstrual cycle will be very irregular in nature. Then there is polycystic ovarian syndrome, wherein cysts are formed that are fluid-filled sacs may form within the ovaries. So these cysts actually prevent the eggs from ovulating. So the ovulation doesn't take place on time, and this condition may be associated with infertility problem, excessive hair growth problem, and weight gain problem. So it is mainly a hormonal imbalance problem, and the cyst can be only detected through an ultrasound. Then there is premature ovarian insufficiency, wherein the condition occurs under the age of 40, wherein the ovaries doesn't function normally. So it can lead to very early menopause. And lastly, there is pelvic inflammatory disease, wherein there is a bacterial infection within the female reproductive system. And this infection can lead to miscarriage problem, extremely irregular period, pain in the pelvic area, extremely heavy white discharge. So these are the very common causes of menstrual abnormalities. So in order to get relief from the menstrual cramps, which is caused due to the contractions of the uterus, we suggest you can try these 3 asanas at home. So always do a research on yourself, by yourself before doing it. You can do this anytime you want, even after your meals. Always wear comfortable clothes and then do it. And always do it on a mat. Never ever do it on the floor. So the first asana is Vajrasana. It alters the blood flow and nervous impulse, and it also strengthens the pelvic muscles. It is very helpful for your digestive system. Next asana is Shashankasana. It stretches the back, realigns the vertebrae, and it also strengthens the pelvic muscles, and it helps in reducing anger and cools the brain. And third asana is Manjari asana, where it improves the flexibility of spine, neck, shoulders, and tones the reproductive system, thereby giving a relief during the menstrual cramps. So one needs to do these asanas regularly, thereby only one can feel a difference. And doing these asanas regularly will be very beneficial for the reproductive system as well as for the digestive system. So sanitary napkins are the most used product during our period days. So it is important that when one has a very heavy flow, one should change the pads every 2 to 3 hours. If one has a low flow, one should change the pad every 4 to 5 hours. So if one wears a pad for a very, very long time, suppose more than 6 or 7 hours, then there could be a bacterial growth on top of the pad. And when that pad comes in contact with the genital area, it could cause infection. So please remember the menstrual blood itself doesn't contain any sort of germs. But when the blood soaked pad comes in contact with air, water, or sweat, in the washroom area, the air which contains bacteria in it would develop a bacterial growth on top of the pad, and when it comes in contact with the genital area, it could cause infection. So please change your pads frequently. So just as we need to change our pads, it is equally important that we need to dispose them off in a responsible manner. So never ever flush it down the toilet. Don't ever throw it out in the open. Always wrap it in the paper and throw it in the dustbin. That is the best way possible of disposal. So always carry a waste paper with you when you're on your periods. Whenever using a public toilet, do not throw it out in the open, because it doesn't look good and it would cause infection to the others. Always wrap it in a paper and just throw it in the dustbin. So you need to maintain the hygiene very properly. So when using a sanitary napkin, please ensure that it has a cotton cover on top of it, because cotton cover pads are much more gentle to the skin and it doesn't cause any rashes. So when you're buying a pad, make sure when you touch the top layer of the pad, it has a cotton cover. So cotton cover pads, as I said, is much more gentle and it is much more absorbent. Please take bath during your period days. Keep yourselves clean and dry. Keep your genital area clean and dry. When washing the genital area, please use plain water. Do not use any kind of soap or detergent or any intimate wash, because if by chance the soap water enters the vaginal area, it could wash away the good bacteria which maintains the pH level, making it more dry and more prone to infection. So just use plain water. If there is irritation, you can use lukewarm water, but plain water is more than enough. Please use clean and dry undergarments. You need to change the undergarments regularly. You need to use cotton undergarments and you need to wash and dry it under the sun. It is only under sunlight will the germs get killed. Please wash your hands before and after changing the pad. When using a public toilet, try to use an Indian style toilet, because compared to a Western style, the point of contact is much less, which prevents the chances of spreading infection. And please store the napkins in a clean and dry area. So one's lifestyle also doesn't have an impact on the menstrual health. So if one is an adult, especially the female members, so the females or the women out there who are of adult, who have already entered adulthood. So please remember, your life choices will have an impact on your menstrual health. So it is a scientifically proven fact that excessive smoking and drinking does have a negative impact on your menstrual health. So excessive smoking and drinking would lead to estrogen deficiency. It could cause irregular period. One has a high chances of delayed conception or infertility problem. One is more likely to deliver prematurely, and one can also reach menopause at a very early age. So whatever you do, please do it responsibly. So we come on to the last slide, wherein we need to maintain a healthy lifestyle. So, of course, we all like to have street food and junk food and fries and chips and burgers, but those food doesn't have much nutritional content in it. So we should always have a balanced diet. The color of our food palette should resemble the color of the Indian flag. Thereby, all the required nutrients are ensured by the body. So many a times you might also hear that one shouldn't eat a certain vegetable or certain fruit or certain milk product during your period days. But again, it is not true. You can have any vegetable, any fruit, any milk product, unless and until you don't have a problem with it. So anything which falls under the category of healthy and nutritious can be consumed during your period days. At times, many girls during their period, they lose their appetite. Why? Because the stomach acid level rises. So in those days, we suggest reduce the intake of tea, coffee, oily food, salty food, and processed food because it raises the stomach acid level. So please do not skip your meals, have it in small portions, but do have it frequently. Never ever skip your breakfast. Drink lots and lots of water during our period days to reduce bloating. In case one is into sports and exercise, one can continue to do so even during their period days, provided their body permits it. If they're comfortable doing it, if you are comfortable doing it, you can continue to do so even in your period days. In fact, maintaining an active lifestyle will help regulate your menstrual cycle. So my presentation has come to an end. Now, if there is any question from the audience, please feel free to ask.
Okay, ma'am. I have a question for you. Nowadays, reusable pads are more available in market. So, hygienic is better in disposable pads. But what about ensuring the hygienic in reusable pads? Is it hygienic?
Can you please repeat once again? Your voice is breaking actually.
Okay, ma'am. Nowadays, reusable pads are more available in market. But hygienic wise, you can see disposable pads are very better, right? How to ensure hygienic in reusable pads?
Hygienic reusable pads.
Yes. How to ensure hygiene in
How to
reusable pads?
Well, with reusable pads, firstly, with reusable pads, I believe most of the reusable pads are the cloth pads, right? Yes, if my knowledge is correct. So, for one thing is that, just a moment. Yeah, with cloth pads, the first is that there was a time when most women used cloth. So from cloth, one has shifted to the disposable sanitary napkins or to the biodegradable sanitary napkins. Firstly, because cloth pads, it is difficult to maintain the hygiene. And why most women, when they used cloth, they were not able to maintain their hygiene. So, and also the absorption capacity of those cloth pads is not good. So no matter how well it is today, at present I have not used a cloth pad, but then again there is a certain doubt of the absorption capacity and the length of how long can you wear that certain type of pad. And of course, when one is using that pad, if it is usable in nature, one needs to wash it properly and dry it directly under the sun. But the problem with us Indian women, but let alone keep the pads in a separate way, we don't actually dry our innerwears out in the sun, out in the open, which should be done. We always cover them under a particular cloth and then we send it to dry them. So if one has to use a cloth pad, then it should be dried directly under the sun. So if they are confident enough to do it, if they're comfortable enough, they can do that. But again, the question of absorption capacity and the question of leakage does come. So if they are comfortable using it, they can of course try it. But there is reasonable doubt in that, and why it has not yet gained popularity in today's time.
Next question, ma'am. Which is better, sanitary pads, tampons, or menstrual cup?
Well, there is no good or better in that way. So it is completely upon the person who is using it. If they are comfortable using that product, it is up to them. Every product has its pros and cons. With pads, of course, if you wear a pad for a very long time, as I said, there could be bacterial growth. Many women do experience itchiness and irritation while using a pad. So for them, again, I suggested that please use cotton cover napkins because it is much more gentle to the skin and it doesn't cause rashes. With both tampons and menstrual cups needs to be inserted inside the vaginal opening. So tampons again are of disposable in nature. One can use a tampon for only 4 to 5 hours. If one wears a tampon for more than that, there could be bacterial buildup on top of it, which could lead to toxic shock syndrome, and it is very fatal. And with menstrual cups, again, it absorbs the menstrual discharge from the vaginal opening. So it collects the blood. So one needs to pull out the menstrual cup every 8 hours, or before that, if it has filled up, then wash it again and then insert it. And one needs to sterilize the menstrual cup before every use and after every use. So again, if one is comfortable using that, maybe one person is comfortable in using pads and they are not comfortable in using tampons or menstrual cups. And it could be the vice versa also. When many women are comfortable using tampons or menstrual cups and they are not comfortable using pads. So it will ultimately depend upon the person. So my experience wouldn't really help with you all. It depends upon you after the usage, whether you are comfortable with it or not. So initially, yes, tampons and menstrual cups is a bit difficult to use. It is only after 2 3 usage that everyone becomes comfortable with it. So till then, there is a little irritation, but yes, it is after 2 3 usage. If it has to become comfortable, it is after 2 3 usage it becomes comfortable. So these are with the products which are available.
Thank you, ma'am. Students, the feedback link is posted in the YouTube comment section. Please fill it to get your e-certificate. Being thankful and expressing your gratitude is an important part of being happy in life. Now I invite Dr. Shamla ma'am, Assistant Professor, Department of Microbiology, for vote of thanks.
Good evening to one and all present here. It's an honor to have been asked to offer a vote of thanks on behalf of Women's Cells of Anna Violet Arts and Science College. I'm very hearty gratitude to propose vote of thanks. First of all, I would like to thank our chairman, Dr. N.R. Dhanapalan sir, our secretary, Mr. N.R.D. Prem Kumar sir, our joint secretary, Dr. P.E.R. Premchand sir, our principal, Dr. Inita Lebanon Ebansi ma'am, our vice principal, Mrs. Jafia Solomon ma'am, for their constant encouragement and guidance in all our endeavors. I take this occurrence to thank today's presenter, Ms. Roshni Bomik, CSR Executive, Unicharm India, who highlighted about personal hygiene during monthly periods. She explained very well about various means available during menstruation and care to be taken for their disposal to avoid environment pollution. She also explained about menstruation related pains and health issues and its treatment. Really, it gave deep insights into the topic, ma'am, and also it revealed some interesting facts also. The point where the speaker told us about the menstrual hygiene was really very informative. I'm pretty sure the precious knowledge will definitely help the students, especially to the girl students. Once again, thank you, ma'am. And I would like to thank our Women's Cell Coordinator, Mrs. K. Meena Ma'am, Assistant Professor, Department of Biochemistry, for her support for the success of this event. A special thanks to the organizing committee, to all the HODs, faculty members for their unflinching support and coordination. And a heartfelt thanks to our students for their active participation. Last but not least, I would like to thank our technical team, Mr. Yonesh Kumar sir, Abhilesh sir, and Mr. Loganathan sir for their constant support in all the times. Once again, I thank you one and all. Thank you.